The truth about European versus US healthcare. Healthcare is a fundamental aspect of societal well-being, ensuring individuals receive necessary medical attention. Understanding different healthcare systems highlights disparities and areas for improvement. Comparing European and US systems reveals critical insights into accessibility, quality, and efficiency, ultimately impacting policy decisions and patient outcomes. European healthcare systems are often characterized by universal coverage and strong government involvement. Countries like the United Kingdom, Germany, and Sweden provide comprehensive services funded primarily through taxation or social insurance, ensuring equitable access and emphasizing preventive care and early intervention. The U.S. healthcare system is predominantly market-driven, with a mix of private and public funding. Insurance coverage varies widely, often based on employment, leading to significant disparities. Government programs like Medicare and Medicaid aim to bridge gaps, yet many remain uninsured or underinsured. Key differences between European and U.S. healthcare systems include funding sources, accessibility, and overall patient experience. European models typically prioritize equitable access and government oversight, while the U.S. system emphasizes innovation and individual choice, often at the cost of higher expenses and uneven coverage. European healthcare systems have evolved through centuries, influenced by social welfare philosophies and post-war reforms. Many countries established universal healthcare in the mid-20th century, focusing on comprehensive coverage, public health initiatives, and continuous improvement to meet the needs of diverse populations.
The U.S. healthcare system has evolved significantly since its inception. Early care was primarily provided by family members or local practitioners. With industrialization, hospitals and specialized care emerged, leading to the development of employer-based insurance during World War II.
European healthcare funding mechanisms are diverse. Most countries operate under a single-payer system, funded through taxation. Some nations employ a mixed model, incorporating private insurance. Despite differences, the primary goal is universal coverage and equitable access to healthcare services for all citizens. In Europe, healthcare accessibility is generally high due to comprehensive coverage and lower costs. Publicly funded services ensure that financial barriers are minimized. However, there can be variations in wait times and access to specialized care depending on the country. Accessibility in the U.S. healthcare system is inconsistent. While many have employer-based insurance, others rely on government programs like Medicaid and Medicare. However, significant portions of the population remain uninsured or underinsured, leading to disparities in access to essential healthcare services. Quality of care in European healthcare systems is generally high, with an emphasis on preventive care and patient-centered services. Outcomes are often favorable due to well-established primary care networks and robust public health initiatives, ensuring comprehensive and timely medical attention. European healthcare systems are often lauded for their high quality of care, which is ensured through stringent regulations and a focus on preventive measures. This approach helps maintain a consistent standard of care across various countries, benefiting patient outcomes significantly. In the U.S., the quality of care varies widely due to the fragmented nature of the healthcare system. While some institutions offer world-class treatment, others struggle with resource limitations, leading to disparities in patient care and overall health outcomes. Patient satisfaction in European healthcare systems tends to be high, driven by accessible services and comprehensive coverage. Patients generally appreciate the emphasis on preventive care and the lower out-of-pocket costs, contributing to a positive healthcare experience. In the U.S., patient satisfaction is mixed. While some patients receive excellent care, others face high costs and limited access to services. The variability in insurance coverage and healthcare provider quality significantly impacts overall patient satisfaction and trust in the system. Insurance plays a pivotal role in European healthcare, primarily through universal coverage models. These systems ensure that all citizens have access to necessary medical services, reducing financial barriers and promoting equitable healthcare access across different socioeconomic groups. Insurance in European healthcare generally operates under universal coverage models. Citizens often receive healthcare through government-funded programs, which minimizes out-of-pocket expenses. This system ensures broad access to medical services, reducing financial barriers and promoting equitable care. In the US, insurance plays a pivotal role in healthcare access. Coverage is typically employer-based or purchased privately, leading to significant variability in cost and quality. This reliance on private insurance companies often results in high premiums and out-of-pocket expenses for patients. Healthcare costs in Europe are generally lower than in the US due to government regulation and negotiation of prices. European systems emphasize preventative care and efficient spending, which helps to control overall healthcare expenditures and improve population health outcomes. European governments are deeply involved in healthcare regulation, funding, and provision. They ensure that healthcare services are accessible and affordable for all citizens. This role includes setting standards, funding hospitals, and negotiating drug prices to maintain a balanced healthcare system. In contrast, the US government has a more limited role, primarily providing coverage through programs like Medicare and Medicaid. The healthcare market is largely driven by private entities, leading to a fragmented system with varying levels of care and access. The US government plays a vital role in healthcare primarily through funding programs like Medicare and Medicaid. Regulations and policies also ensure patient safety and care standards, yet the system remains fragmented, impacting equity and efficiency. In contrast, European governments generally provide universal health care, ensuring that all citizens have access to essential services. The centralized approach allows for more uniformity in care standards, although it may lack the flexibility found in the US system. Public health initiatives in Europe often emphasize preventive care and community health, leading to long-term cost savings and improved population health. Programs targeting vaccination, smoking cessation, and healthy lifestyles are widespread and well supported by government policies. The US takes a more reactive approach to public health, often focusing on treatment rather than prevention. Efforts like the Affordable Care Act aim to increase access, but public health programs face challenges due to inconsistent funding and policy changes. European countries generally have robust healthcare workforces, supported by government investments in education and training. This leads to better patient outcomes and higher job satisfaction among healthcare professionals, although some regions still face shortages and resource constraints. Public health initiatives in the US focus on preventive care, vaccination drives, and combating chronic diseases. Programs like Healthy People set national objectives, while local agencies address community-specific needs. Efforts include smoking cessation, obesity prevention, and mental health awareness campaigns. Case studies highlight the challenges in the US healthcare system, such as high costs and unequal access. Instances like rural hospital closures and the opioid crisis underscore systemic issues. Despite technological advancements, disparities in care quality and insurance coverage persist. Future trends in European healthcare emphasize integration of digital health technologies and personalized medicine. Embracing telehealth and data analytics, Europe aims to enhance patient outcomes and streamline services. Cross-border healthcare collaboration is also expected to grow, fostering innovation and efficiency. Future trends in US healthcare focus on value-based care and reducing costs. Advancements in AI and telemedicine aim to improve patient experiences. Policymakers prioritize addressing disparities and expanding access, while stakeholders push for more sustainable and efficient systems.